Good morning. I am Sharada Mani. I am the head supervisor of Toronto Elderly Care Facility, and I will be interviewing for the post of caretaker. So let's start the interview. First of all, we'll be going for with Aishwarya. So Aishwarya, can you give us an introduction?
I'm Aishwarya, and I'm an nurse with 2 years of experience working in the healthcare industry. I have completed my bachelor's in nursing from University of Toronto in 2020 and have worked at Spectrum Healthcare for 2 years. There, my responsibility was to look after the post-operative and pre-operative patients of the ENT unit and medical surgery unit. I had to document the vital signs and such as blood pressure, heart count, blood count, and insulin levels. There, I also assisted the patients in bathing, dressing, and eating, and also coordinated their healthcare needs, such as medicine administration, also pain management, and physiotherapy. I was in charge of about like 7 patients at that time, and my previous work experience has equipped me in properly recognizing the signs of a complication and also administrating the necessary first aids. These experiences makes me confident that I can deliver good uh, quality patient care, and I also have great communication skills, which makes it easier for me to communicate with the patient and their families, and also to address their worries. So, thank you for giving me this opportunity to interview. Thank you.
Okay. Okay. Can you provide an example of when you had to advocate for an elderly patient's needs or preferences?
Oh, okay. As a nurse, I believe it's necessary to advocate for our patients' needs because I had this one situation when I was working in Spectrum Healthcare. We had an elderly patient who was bedridden after the surgery. He was taking his time to recover. During that time, he had to take some specific food, like specific meals and balanced meals to keep his nutrition up, but he had some kind of cultural or I think religious beliefs which prevented him from taking specific diets. So he couldn't eat meat, some kind of meat and all. But the hospital staff didn't know that. Like the standard meal options of the hospital didn't align with his personal preferences, and he had a hard time um, taking up his parents' nutrition. So I recognized his issues and I communicated with the meal operating team, and I explained how it's the importance of respecting his cultural beliefs and how it makes him a better uh, how it how it makes his health and his well-being overall improving his state of happiness and health. Like I try to communicate the issue with the hospital management team, and they recognize the importance of making sure that his needs are met. So thereby, I was able to advocate for an elderly person from my previous experience.
So, how do you prioritize tasks and manage your time effectively when caring for multiple elderly patients with varying needs?
So, as a nurse, I think it's important to have attention to detail and to be able to multitask when the situation comes up. So, as I told you, like I had like about 7 patients in my previous healthcare industry. So, usually I start by assessing their health chart and history, and I also assess their current health state. Then I prioritize the task or the urgent task that has to be met. And then I also organize the tasks according to each patient's condition. And I try to openly communicate with the patient and their families in case they have a worry or they have any issues that has to be um, accommodated. The last thing I can do is I can collaborate with other health professionals like other healthcare caretakers of the industry to make sure that the needs of my patient is met.
Okay, thank you, Aishwarya. Let's move on to the next candidate. So we have Sri Parvati here. Sri Parvati, can you uh, introduce yourself?
Hi, my name is Sri Parvati Mohan. I have bachelor's in social worker. As if now I don't have any experience, but I have done internships in this field.
Uh, can you tell me about your educational background and how it relates to elderly care?
During my BSW program, I learned various aspects of social work, including human behavior, psychology, and providing support to the individual. These studies emphasize the significance of promoting the well-being of elderly people. Also, these studies help me to understand the needs and challenges faced by the elderly population. During the practical training, I gained hand-on experience in assessing and addressing the social and emotional aspects of well-being of the elderly people.
Okay, communication is vital in caregiving. How do you communicate effectively with elderly patients who have difficulty expressing themselves or understanding instructions?
Communication play a vital role, especially when we are dealing with elderly patients. I have learned and implemented various communication strategies. Firstly, I prioritize active listening. It allow individual to express themselves without rushing, and additionally, I utilize nonverbal signals such as body language, facial expressions to understand their concern and need, and I adapt my communication style to the individual preference. It involves using simpler language or incorporating visual aids. Also, using visual aids and written instruction, it helps to enhance the communication. Lastly, I aim to create an environment where they feel comfortable to express themselves and build a positive and effective relationship between caregiver and patient.
Thank you, Sri Parvati Mohan. Okay, then let's move on to the next candidate. We have Andros Sebastian. Can you give an introduction?
My name is Anne Sebastian. I'm a registered social worker in Canada. I had completed my master's in social work from University of Waterloo. After that, I had was working as a full-time personal support worker in a registered care home in Toronto.
So, can you tell me about your experience working with elderly individuals or in a healthcare setting?
Throughout my academic and professional journey, I had the privilege of gaining valuable experience working with elderly individuals in various healthcare settings. During my placement and internship, I had the opportunity to work with elderly in healthcare homes and also care homes, especially. I provided personal support to elderly individuals with diverse needs, such as providing for the bedridden and also for the disabled and coping with chronic diseases too. I assisted them in the daily activities such as bathing and also dressing, medication management, and I was also involved in meal preparation too. I also collaborated with the other teams in the multidisciplinary areas to develop and also create new plans for the elderly individuals. Throughout my experience, I developed a deep understanding about the physical, emotional, and the social challenges that elderly individuals are facing. So I gained valuable skills in providing compassionate and holistic care for the elderly individuals.
How do you approach building rapport and trust with elderly patients experiencing physical or cognitive challenges?
I take time to genuinely listen to the concerns and also the preference of elderly individuals who are experiencing various challenges. I engage in open and successful communication. I believe that having a proper communication with each other is much more essential in this field. Additionally, I strive to create a comfortable and safe environment for the patients so that they feel they are being valued and also empowered to express their feelings while having their care in the homes. By showing all my respect and also being dignity towards the care patients, I believe that I am able to provide reliable and compassionate work in the care practices. Also, I provide a sense of trust and also partnership with elderly people, and so that it helps them to be more into the work, into this environment. So I believe that being a supporter to them is the one thing that I mainly do in this care by providing care to elderly individuals.
Thank you, Ambrose. Now we can move on to the final candidate, that is Mohammad Hunay. So, can you give us an introduction?
My name is Muhammad Hanan. I have a master's in psychology and a strong background in caring for the emotional well-being of elderly individuals. I bring a unique perspective to the role of a caretaker, focusing on both physical and psychological aspects to ensure comprehensive care for the patients.
What strategies would you use to support elderly patients experiencing loneliness or isolation?
I'll use my psychological knowings to create activities that matter to them, help build friendships, and genuinely listen to their feelings. Making a friendly setting and getting them involved in group activities can make a real difference in easy loneliness for elderly patients. And I know that will be a good idea to implement my study background in this situation.
So, can you share a specific example of a challenging situation you encountered while caring for an elderly individual and how you handled it?
There are times I've gone through this kind of situation and I handle it smartly by implementing my field knowledge into the situation wherever needed. I have helped a lot of elder people. Certainly, I had a patient who resisted getting dressed that was causing stress to him each morning. To address this, I introduced a more relaxed routine, allowing them to choose comfortable clothing, and which was a good idea by respecting their preferences and taking a gentler approach, we transform the morning routine into a positive and less challenging experience for the patient. And now he dressed like a gentleman. Now we can call him a model too, which is pretty awesome.
Thank you, Mohammad Hunay. So, thus we have come to the end of our interview session. Is there any questions that you would like to ask me?
I actually have a question. Like, what type of workload do you expect for someone in this role, and how do you think of like ensuring that it's manageable?
The workload for this role can vary according to their duties. We aim to ensure that each caregiver has a workload that allows them to provide quality care without feeling overwhelmed. We prioritize balancing the number of residents. Each caregiver is responsible for the complexity of their needs. We have systems in place for ongoing assessment and adjustment. We regularly review staffing levels and resident needs to make necessary adjustments. Additionally, we encourage open communication between caregivers and supervisors to address any concerns or challenges.
Okay, thank you.
Is there any more questions that you would like to know about from our side?
I do. Could you please tell me more about the day to day responsibilities and the tasks in the caretaker position that I'm going to be enrolled?
The day to day responsibilities and tasks of this position can vary depending on the specific needs of the residents. We mainly look forward to our people's care, that is, assisting with their daily activities like bathing and eating. You will be responsible for monitoring them and administering them with prescribed medications. Some residents might require mobility, so you will be asked to transfer them from bed to chair or wheelchair. You will play a crucial role in ensuring the residents' comfort, safety, and well being.
Thank you.
Thank you, candidates, for your interest in this position and for your valuable time. Our team will get back to you about the results in the coming days. So, thank you, one and all, and have a wonderful day.